Good afternoon, Janine. Ed, you have a new picture every time I see you.
I like that one with Blaze. That's cute.
Got to change it up, Tim.
That's right.
How you doing?
Hanging in there. Still working from my office at home, getting to campus once a week or so, something like that.
I'm coming in more like 4 days a week now.
Wow.
It's still very quiet here.
Yeah, that's what I've been hearing. Do you have all your instrumentation back for the cow room? Are we up?
Yeah. We had two pumps that failed on us after we installed it, but that's all been taken care of now.
Okay, that's good news.
It's always fun.
So why don't we wait a minute or so longer? Christine told me we had over 50 people registered. People are still logging in. Well, what do you think, Janine? Should we do it? You're muted.
Let's just wait one more minute. If someone just finished a meeting and needs a little bio break. All right, we can probably go ahead. We had quite a few people join in just the last 30 seconds.
All right, let's do this. I will share my screen here. Get you guys on the other screen. I can see you. All right. Put this in share or in presentation. Okay, you guys seeing that? All right. Thanks everybody for joining us today. This will be very similar from the last time. We've got some new information to share, and then I'm assuming that there might be a number of people on this call that didn't join us in May when we did this, and so a number of these slides farther down have the same information with hardly any updates to them. All of the new updates we'll just cover here in the first little bit. So if you want to, feel free to jump off after you start hearing repetitive information. Feel free. If you want to ask a question, I don't mind being interrupted. So you can put your hand up, and Janine can let me know or whatever. And then for those of you that haven't seen some images of the building, I've got some images that I showed last time. And it looks like I got them twice on the agenda even. So there you go. So first of all, several questions were submitted as part of the registration form, and Christine forwarded those to Janine and me. And so I thought I would just answer those quickly, and then we'll just move on to some of the more recent updates that are pertinent to all of you guys. So is the University Hospital Clinical Laboratory moving? So no, they're going to stay in the Leprino building, and more than likely they'll probably take over the CTRC core lab that's on the 3rd floor when we vacate, because we're connected to their lab with a tube system that goes over to the hospital. So I wouldn't be surprised if they expand into that space. And the new lab will be, and I've got some floor plans to show at the very end of this. and I can give people a walkthrough quickly of, the spaces for the CTRC. The core lab, the new core lab, excuse me, is immediately adjacent. It's in the same contiguous space. So movement of samples from the CTRC clinic, outpatient clinic, to the CTRC core lab will be, similar proximity to what you're used to. After we box up samples, we bring the box to the UCH lab. This will be more difficult than not in the same building, and that is true. You will have to walk, and I've got a map here on one of these following slides to show you exactly where this building is if you're not aware of it, and about how far the distance is between this building and the Leprino building. Also, there clearly will be a walk over to the inpatient unit if you're flowing back and forth between the two CTRCs. And that will involve going outside. So in inclement weather, you can no longer make your way across the bridge and into the main hospital. Probably 3 or 4 minutes at most to go from the new Anschutz Health Science building over to the UCH inpatient unit. Obviously, waiting for elevators and whatnot may increase that time. And then in terms of drop boxes or pickup boxes for UPS and FedEx, I have a question out to the facilities folks to see if there will be one in this building. The important thing to note is that this building shares a loading dock with RC2. So I don't know if RC2 has dedicated pickup boxes for UPS and FedEx, and if they do, I don't know where they are. If they're in the dock area, then that would be extremely convenient. The other thing about this new building is it is attached somewhat to RC2. So there's a crossover on the second floor of this building over to RC2. It comes out directly in front of the Krugman Conference Center, just above ETIES. So that's where you can connect to and from RC2 and then walk across to RC1 if need be. So just to refresh everybody's kind of knowledge of where this building is, Leprino is right here on the corner of 17th and whatever street that is, Racine. And the Leprino parking garage is just to the east. And this building is just on the north side of the Leprino parking garage. So actually, as you come out of the loading dock for the Leprino building, you can just kind of skirt around, and the entrance to the new building is right here. So that's kind of the distance between leaving the Anschutz Health Science Center and walking over to Leprino. Or if you're going to go into the inpatient hospital, you would probably want to come this way on the, in this alleyway between A01 and the parking garage, and come in to the hospital here on the east side of what is now the ambulance drop-off area for the hospital. I'm going to re-show this map again in a couple of slides when we talk about parking for those of you that are interested. Here's the meat of the new information that we have to share with you. We have created a button, thanks Chris, on our website where we will be providing updated information as we move along. It's pretty skeletonized right now. I'm going to flip over to it in a second just so that you can see where it's at. And probably one of the important things is that I asked Chris to post the link that they have for the research pharmacy that's going to be in this new building. He put a button on this UCH outpatient move page that will link over to the research pharmacy website. Janine provided the website link to me yesterday, and I actually tried to find it on the CU Anschutz page, and I couldn't figure out where the hell it was. So I thought, let's just stick it on our page. And if you guys are looking for it, you can link over to it. Let me see if I can get over to our, so if you go to the CCTSI homepage, and for those of you that may not be familiar with the easiest way to get there, just Google CCTSI, it comes out at the top, and then you can click into it. And on our homepage, if you just scroll down, it's the button for the move information will be here. And Chris has built this, and Janine and Wendy Meyer are going to be building it out with more information as we progress closer to the move. But here's the button to the research pharmacy. And so then this is their dedicated page, information about their services. As you get down a little, you can start seeing fee structures for industry and non-industry studies, contact information, and the like. Another point, Diane and CTRC leadership are reviewing CTRC outpatient policies and standard operating procedures. And we'll be determining if we need to modify any of those because of the new space, or change them because our organization might not be directly under UCH kind of authority. Then we'll notify everybody of any changes that would be relevant to your research, and those also would be posted on the move page. We plan to offer scheduling for walkthroughs for research groups as we get closer to the move. So probably in early October, and have the opportunity for groups to register for a time to go in, go up to the 6th floor where we'll be, and just tour the facility, see how your patients are going to get up to the facility, see how they're going to register, where they're going to register, where's the phlebotomy spaces, exam rooms, and things like that. So we will let people know the next time we do one of these town halls, what the registration process would be like. It's going to be important that everybody have an active UCD or CU Anschutz badge. That we won't be in a hospital building. For those of you that are coming on campus now, you know that most buildings are still badge access only. That's true. That's going to be true for this building unless they change that in September. But then some of the spaces specific to getting to the CTRC core lab and whatnot might be badge access for folks. And so anyways, it's just an important note that make sure that you don't have an expired badge. And then working on phone numbers. All CCTSI staff and personnel will be getting new phone numbers, and we will probably only be forwarding the very main numbers that have been in place for years for the clinic, the core lab, the nutrition operation, the main CCTSI number, which hardly anybody calls anyways. And we'll forward those, but we won't be forwarding them indefinitely. We'll be forwarding because those are actually university hospital exchanges, the 720848. And we're going to be now in a CU Anschutz building with a CU Anschutz exchange, like 724315 or something like that. And so we will be forwarding those for a limited period of time, time for folks to make sure that their research participants are notified, and if any of the contact information in their their advertisements and other documents need to get updated. So just be on the lookout for that. We'll definitely post those, notify you, and they'll be on the move page as well. So the next bit of information is actually what's the move process going to be like. We finally got an approved move schedule that came out 2 or 3 weeks ago. And so here's the relevant information. The clinic itself will be closed October 28th, that's a Thursday, through Sunday. And we'll be reopening the clinic at 9 a.m. on November the 1st. That's, as you know, that's later than we would normally open. We felt it would be important for our nurses who are orienting over to that new space as well, and other CTRC affiliated personnel to get kind of familiar with the routine a little bit before we actually open the doors as early as we usually do, around 7 or whatever time that is. So anyways, they'll be moving we'll be packing on the 28th in the clinic, so we'll be closed. We'll probably move all day Friday. If we have to, we'll move Saturday, but we'll definitely be setting up Saturday and Sunday. Obviously, there won't be any visits that you can schedule during this period of time. And Jenny and Janine will have locked out the scheduler for any of those days anyways. The core lab will be closed the 27th through the 30th. They'll be shutting down instrumentation starting Monday and progressing through Wednesday, but they will maintain the ability to accept and process samples that may have been collected up into CTRC clinic in Leprino up through Wednesday. So that will be, and then they're going to be available to reopen. Also on that Monday is the plan to be able to accept new samples and process them as necessary. They will be bringing all of their instrumentation online, so they may not be, up and running and ready to do safety labs and other things, immediately. If you have concerns specifically for your study about that, be sure to reach out to Karen Morgenthaler so that you can know exactly what their capability is going to be. The core lab will be moving during that same period of time, I actually think their move might be scheduled on the 1st, but they're going to be closed down the 27th through the 2nd. Janine, do you want to specifically comment on that closure right now? What does that actually mean for people? No diets will be produced, but can people pick up things?
We plan to produce the diets ahead of time and have them picked up a little early. So we don't anticipate any interruption to diet services, only to things, and no interruption to services at children's. We can still do anthropometric measurements and RMRs on those dates. So we're trying to have as little disruption as possible. We will not be able to do anthropometric measurements at the adult CTRC because they'll be closed. But our children's operation will remain open and our diets will prep ahead of time.
Okay, thanks. The image exercise facility is going to be closed for a longer period of time. They're the most complicated move. They have to have a vendor come in, disassemble the vast majority of their equipment, move it over. The movers will move the equipment over, and then the vendor will reassemble a lot of that. So if if you're involved with that group, make sure that you pay close attention to any of their notifications that would be specific to your research, around their operations. For the, just, I'm going to back up to the clinic move. The clinic move shouldn't actually be that complicated. I hope this is good news to many of you. I've gotten Dr. Sokol to agree for us to purchase new exam tables. Those exam tables that are in the clinic came over from the old hospital. And you guys have probably heard me say this, that some of those tables are probably older than me. So, and I don't think a single one matches from one exam room to the next. So we did get Ron to approve that. So I've got those ordered. We're getting 8 new exam tables to put into the new exam room. So
sorry to interrupt you, Tim, but we got in the chat, hooray for new exam tables.
Very good. Okay.
People are tired of the ones from 1946.
Yeah. What else was I going to say around that? So, so they're not moved. So that's not moving the exam tables isn't part of the move. So really, and then all of the computer infrastructure that's in the Leprino clinic, almost all of it's UCH related stuff. So we're getting all new computers for the exam rooms and the procedure rooms and things as necessary. Tom Yeager's team will be in there in September and early October, installing all of that stuff. So really, we're moving supplies, we're moving blood pressure machines and the other research instrumentation, but the movers don't really think that the CTRC clinic move itself is going to be all that complicated. And then for any of you on this call that this is relevant, CCTSI offices and cubicles, as well as Dr. Regensteiner's. Deidre, I see you're here. I didn't see Chantel to see if there's anybody from Netta Rasuli's group on here, but all of our cubicles and office spaces that are kind of behind those locked doors in the hallways, they'll be moving throughout this period of time, October 26th through the 30th. As they have available kind of capacity between some of the other scheduled moves, they'll go in and they'll grab stuff from some of the cubicles and office spaces. So we have been informed that everybody needs to have their offices packed up and ready to move by the close of business on the 25th of October. Okay, Janine, in the chat, anything relevant to these updates that we should talk about right now?
Not right now, no.
Okay. And this is the last slide with any kind of really pertinent updates. So after I get through this, if you're not interested in some of the material that we reviewed last time, you can start dropping off the call if you'd like. Like I said, there's some pictures and there's some floor plans that I'll go over at the end of this. So, so just to reiterate, the UCH inpatient unit is not moving. It's going to stay over on the 12th floor of the hospital. So there's no change in scheduling visits around the inpatient unit. Janine and Jenny have updated scheduler so that all active studies can now schedule up through the 27th. You won't be able to schedule anything that 28th, 29th, 30th when we're just entirely closed. The system won't allow you to do that. You all are probably familiar with this by now, but Janine wanted me to make sure that you know that if you're going to schedule at Leprino, you have to pick your protocol or visit or whatever you do in there with the prefix that's LOB. And then the next bullet there, you can start scheduling visits from November the 1st and beyond in Scheduler. Janine, that's open for people to do now? Okay.
Opened at 9 a.m. both of these opened at 9 a.m. this morning, so they're all available.
Okay, great. And then the important note there is if you're scheduling for Andrews Health Sciences, make sure that you pick your visit name and number that does not have a prefix, the LOB prefix. And then you can read that last bullet. So Scheduler has been updated, as you just heard, and you guys can now proceed to schedule as necessary. So talking about parking. So nothing really new on this slide. I don't know if I mentioned the number of parking spaces that we're going to be, and I've got the next slide is that layout again. So again, here's the building, the parking lot that they're kind of going to dedicate to service this building for visitors and patients is this half of this parking lot. And I saw a diagram where they're going to rework this area of it. So participants will come down this drive here and proceed into this lot with a new kind of entry area right here. I am told that this will have those pay kiosks like you're used to seeing in the other visitor lots. It's $1 an hour, maximum $8 a day. Terry Carruthers had mentioned that there is the option for research teams to buy vouchers or codes to provide participants so that the charge then gets paid by the research team. As you're all thinking about that, we're still working with Terry Carruthers on what they're going to do about having research, having research teams basically pay or participants pay for parking in this lot when they come for a visit. We have stressed the need that we can't be asking our research participants to pay for parking. And that now imposing a parking fee on research teams is going to be a burden, especially in the short term where budgets weren't created and funded with any kind of a line for parking expense for participants. Terry got back to Wendy Court and me a couple of weeks ago and said that she's really trying to work on what we can do about parking costs for research. Basically, stay tuned was her note. Worst case scenario at this point, there's going to be mechanisms for research teams to figure out how to allow their participants not to have to pay to park. But know that this is an issue that we push every time we have the opportunity to get in front of Tom Flagg or Terry Carruthers on this issue. So the light rail access, obviously the light rail stops, up there on what is that? Fitzsimmons Boulevard, and you could get on the circulator. The closest stops for the circulator are right here in front of AO1. So you or your participants would get off and walk into the building. However, there's a stop right over here. Right here. This is the Health and Wellness Center up here. And I believe the stop for the circulator is somewhere on this corner. While we're on this page, this is a visitor lot that visitors and participants could use if there were capacity issues in this lot here. And then this 400 lot is going to be reworked. This entryway here is being widened and more formal. For those of you that have been down this road behind Leprino, it's more like an alley. So they're going to rework that into a regular kind of a street that's nicely paved and and landscaped and whatnot. The majority of these spaces will still be here, and this is also a visitor pay lot that could support this building. Comment about we've had discussions about how are they going to reserve spaces only for participants. I've raised the concern that with the remote hybrid working situation that we're having and that many groups are moving towards, there's going to be lots of actual employees who don't pick up the monthly part-time 10-day option that you all have seen the emails about, because they might not even be on campus 10 days a month. They might be on campus 2 or 3 days a month. And in that case, they're going to park in a visitor lot. What's that going to do to the capacity of these spaces for our patients and research visits? Also in this building are all of the Department of Psychiatry, clinical research, and actual clinical operations. So all of their patients are going to need parking to come in and out of this building. So parking's still really kind of in flux, and I think all I can tell you is stay tuned on the parking issue, but we're pushing to make sure that we definitely have sufficient capacity for participants to come and access the building. Nutrition operations, I don't think we have to share too much here. For those of you that don't know, the metabolic kitchen operation that's actually in Leprino next to the core lab is now moving over to the health and wellness center. There's a well-equipped kitchen, that was designed into that wellness space at the time that it was built years ago. It's been underutilized, and the chancellor was very emphatic at the time that we were talking about moving over to this building that he was not going to build another production kitchen, research kitchen on campus, and that our option was to go there. So Janine's crew, Tyson, John, and Dan, will be moving over to the Health and Wellness Center for all of their meal production. They'll have some office spaces over there as well. Your participants could pick up diets there if they had to, if they didn't have a scheduled visit on the inpatient unit or the outpatient unit where we would have the diet transferred to, or they'll certainly be able to pick up their diets, their research diets in the new CTRC outpatient clinic in the Institute Health Science Building. There is a small nutrition space that we've planned into the new building for kind of meal prep, just kind of prep and way back types of things. And so we've got the ability to store meals over there that are prepared at the Wellness Center and be transferred over on a daily basis. Okay. CTRC billing is still up in the air. So I think for those of you that joined us last time, we're obviously not going to be in a university hospital building. And so with standard university hospital policy around Epic, if it's not in a UC hospital facility, then the Epic configuration is slightly different, and it kind of flows through CU Medicine. The Epic interaction for you all as research teams in terms of scheduling appointments or confirming, whatever you do with appointments and medical record numbers and making notes in visits and looking at medical records, et cetera, all of that functionality is the same, what I'm told. But the billing operations, the financial flow is different. We don't yet have an absolutely confirmed communication from Barbara Carveth, the CFO of the hospital, as to whether they are going to allow us to be an exception and exist in a non-UCH building and have the Epic configuration to remain the same as it is now, which would allow us to bill through Epic like you're used to, getting your invoices and then processing those through Marketplace. Or whether we have to kind of get reconfigured and affiliated with CU Medicine, which will change the billing options that I have to actually explore. One option is we might just abandon billing on the outpatient through Epic at all and use the iLab system. And so you would get invoices electronically through iLab. So for those of you that get invoices from the core lab or the nutrition, or use one of the other core labs on campus that are in iLab, that functionality would be exactly the same on your end. And actually probably easier because charges are directly just posted to your speed type. You have the ability to get a copy of the invoice electronically, but you don't have to do anything with it other than get back to us if you discover an error that you need us to fix. But otherwise it posts directly to your speed type and you just move on. So around billing related to CTRC outpatient use, another one of the stay tuned kind of things. One of the ramifications of this kind of reorganization of the Epic configuration is that it does affect how labs get received by the UCH clinical lab. And so there's another special process that Lori Blumberg's team, if part of your protocol involves labs that are collected, on the outpatient unit and have to go to the clinical lab for some kind of an analysis, Lori's team will work with you. There's a requisition, a paper requisition that actually gets generated and has to accompany the sample. And then her team does some kind of a beaker build in Epic itself, so that Epic knows what to do with that sample when it arrives with the requisition. So more on that as we get clarification around this issue. Oops. Sorry, okay. For those of you that haven't heard, there is a dedicated research pharmacy in the new building. I'll show you on the diagrams here that I have where it will be. And it's going to be full service for research. Not anything for, your clinical, you can't get your clinical prescriptions or anything like that there, but it will be full service for research. Sam Ellis is the director. He's an associate professor in the School of Pharmacy. He's been in charge of research pharmacy operations that service the Barbara Davis Center for a long time. He has very close relationships with the folks in the UCH Research Pharmacy. We're working closely with the UCH Research Pharmacy in the transfer of operations for outpatient support. And so Sam has those connections made, and they've got the protocols that are going to be affected, and they're reaching out and we'll be starting to have conversations with each of you that are affected as we move throughout the summer. Here's that web link. So if you get the slides or access the slides afterwards, Chris, are we going to put these slides on that move page?
Yeah, we can.
Okay, so if you guys want to copy this out, you can, or you can use Chris's shortcut and just access the pharmacy website through our site. There's your hours of operation, and one question came up before: what happens if you have a study that uses both inpatient and outpatient and needs research pharmacy support? Sam's team will work with the hospital pharmacy on that, because if drug is going to need to be administered on the inpatient unit, it has to come through the university hospital pharmacy. Probably depending upon where the majority of the activity occurs will determine whether the drug resides and the protocol resides largely in the UCH pharmacy, if it's largely inpatient focused, or in the Anschutz Health Science Pharmacy. And then as necessary, drug would be transferred to the appropriate pharmacy for further routing and administration. So delivery services, here's the address, and Chris also posted the address on the move page for those of you that are needing this later on. We're on the 6th floor of the building, so that would be the only thing to add, probably to add to this, CTRC 6th floor if you need something to arrive up there. What we've been told is that the university is able to give badge access for UPS, with US mails is irrelevant. It goes to campus services and then comes over to the regular mailboxes. But UPS, FedEx, and like DHL, the major carriers, they have standard deliveries to campus with standard delivery people. So they know who's coming and when. They can give those people kind of vendor access, badge access to the building, so that they can actually bring your packages up to your office spaces if you're in this, or if they need to come to the clinic. We're having a problem with Amazon because Amazon they're not able to have a consistent run to campus. So they come on different vans, they come with different people. There's no way to know who's coming. And so this is really affecting Janine's operation. They order a lot of their nutritional supplies through Amazon Fresh. And so we're having to figure that out. I don't know how much this is really going to affect you research teams, but those of us that reside in this building, this might be an issue that we have to work through. Again, we will find out the information on whether there's going to be dedicated drop boxes for outgoing packages for FedEx and UPS and whatnot in this building, or where the closest place is, and be able to disseminate that information to you. So I think that's the last of the informational slides. For those of you that want to look at a few pictures, and then I'm going to show the floor plan and then hang with us. So you saw the picture at the very beginning. Let's see if I can get back to really fast. This is what the building looks like pretty much right now. Some of us had tours last week and the week before. Doesn't look a whole lot different than this. They still have all kinds of landscaping and whatnot to do, but they're completely closed in. So that, that's nice. And here's this is just a rendering of the ground floor of the building. This would be looking from like the sidewalk right between, say, RC2 and AO1, kind of looking that way. This is going to be a full service sit down restaurant here. So, if you want to go in and have a full service lunch and whatnot, or even afternoon and dinner, they're also supposed to be working out a way to cater. I don't know who the vendor is yet, but to cater for programs that are having events and need food. They did mention that they're trying to associate a liquor license with that as well. So, so there might be the opportunity for this operation here to cater food and beer and wine and whatnot to events on campus. The entry to the building from this area is right here. And I'll show you, there's another rendering how you flow through. And this is kind of what they're thinking the landscaping architecture is going to look like as you come from that direction. So here's those doors I was just circling, the entryway. And this building is designed as a completely open floor to ceiling atrium space. Lots of light filtering in. I've got an actual picture that I took from my tour last week or the week before. There's going to be a grab and go type deli down here in the corner. Some of this stuff is classroom use on the first and second floor, and there's spaces, in this whole area here. This is going to be a big university-run electronic media board for information on programs that are in the building, programs around campus, blah blah blah. So here's the pictures that I actually took from our tour. So it actually kind of looks like they're rendering. This is from the ground floor. Those glass doors coming in off of that sidewalk are behind me. So looking up kind of that sweeping, staircasey place. This is a conference facility up here. So this building has, we'll have a conference facility. I think that we'll seat around 300, but then have the ability to wall off that large space to a 200 seat and a 100 seat area. And they've got some spaces for some little breakout rooms and stuff. And also this area right at the top of the stairs here, if you go off to the right, that's the hallway that will lead into the Krugman conference space. So the hallway that goes over to RC2. This building, this picture here, I took from our floor, from the 6th floor, I believe, looking down into that same space. So it's kind of cool. It's got some of these hanging stairways, and you got these walkways around the interior of each floor that you can look down and up. And this is what the open, the glass ceiling looks like to allow all the light come through there. Let me flip over to some floor plans, and this will be the last. So if we can answer some questions if people have it, or we'll be done after this. So this is the 6th floor of the building. I've cropped this plan so it's only showing basically the north half of the 6th floor. This is part of the open atrium space right here, and these are the elevators right here that are the public elevators that will bring your participants up to our space. There's another main entrance on the west side of this building where people would come in off the street sidewalk level and come into this space here on the 1st floor, grab the elevator, and head up. So they would walk in if somebody's coming just for a research study. So if there's any of you exercise research, part of the image group study. So if there's any of you on here that have that, participants can come in directly right into the exercise space if they don't have an affiliated CTRC visit. Otherwise, they would walk across this hallway. Our main entrance is going to be right here. We have a small waiting room. Unfortunately, there's a column right in the middle of it. This is our reception area right here. And then depending upon what your activities are, how you would flow through the space. So just quickly, I'm just going to kind of try to outline some of these. We have one small kind of interview room or consent type room. Otherwise, we have 10 exam rooms right here, all the same size, and will all be similarly equipped. These two exam rooms right here are negative pressure, single pass air to support marijuana related research. And here's a little vitals alcove. And here's an entry to this is the new phlebotomy space right here. Important to research teams that are on this call. There's 10 hotel spaces right here that will all have computers, and there'll be a multifunction printer here available for your use. This is where you can hang out now. This replaces the PRA bullpen that's just right outside of the nursing unit now in the Leprino CTRC. So there's 10 spots here for general use. Quick highlights, this other interview room we have already determined will be converted to vascular imaging echocardiography room. So that'll be Brooks' space. We have 3 procedure rooms that will have beds or stretchers in them, analogous to the size of procedure room that we have now in the CTRC Leprino. This is the 2 significant improvements for this space. These are essentially 2 hospital type rooms. They have their own bathrooms. They're much larger. We're calling them clamp rooms. The plan is to move any insulin clamps from the inpatient unit down to the outpatient unit, and any other activities that are done on the inpatient unit now that can safely be done in the outpatient unit, but are being done up there basically because we don't have a big enough space in the outpatient unit to conduct whatever the research activity is. This is the infusion suite. We have 5 chairs. One has its own private little room, and the room itself has a toilet now, which is an improvement. We got a small conference room in our space, and here's where the DEXA run by the image group, the DEXA and the new QPCT or PQCT, whatever it is, scanner will be in this space. This is the exercise testing room. For those of you that use that KINCOM instrument, it's going to be located here. You progress over into the image exercise area, the locker rooms, women in locker room, and all of their exercise space and all of their study coordinators. So in a nutshell, that's the new clinic. Oh, and I wanted to say that I didn't mention this last time. For those of you that perform walk tests, we're going to be set up in this hallway here. We've determined ahead of time that it's long enough so that you can continue to do the walk tests at the same distance that you're doing them now. I'm going to scan down on this a little bit just so that you'll see where the laboratory is. So, so here's phlebotomy, and we made sure that there was a way to access into the core lab area from the phlebotomy room. And so, samples to nurses or study coordinator, whatever, can walk a sample straight over. There's going to be an intake area in the laboratory right here. I cut this off. The laboratory is really quite big, so it proceeds farther down. But I just wanted to get the pertinent location in here for you guys, that this will be the intake area for the laboratory. Samples can come straight through. If you were bringing samples from someplace else on campus for some reason and needed to bring them, there's a door into the space right here. And this is kind of one of the spaces that I was indicating that would be badge access. And so we don't know if that's just going to be open during business hours or badge access all the time, but one other reason to make sure that you have an active badge for the space. Janine, or Diane, you're on the phone too, I thought I saw. Is there anything anybody else wants to point out about this, or are there any specific questions that we need to answer around this space?
Not that I can think of, unless
Okay.
people have questions.
No, I
Right.
can't think of anything.
Okay, thanks, Diane. So message to anybody that's on the call. You can put it in the chat, or you can just take yourself off mute if you want to ask a question, or if you want us to consider something that we hadn't thought about yet.
Do you want to stop sharing, Tim, so we can see people?
Oh,
if they wanna
yeah. Good
speak
idea.
up?
All right, well, I haven't been reading the chat. Janine, I'm guessing you've been answering questions along the way. And nothing in there we need to talk through?
No, just some of the things we're still working on, like the nearest drop-off for lab samples and so on, which we're still working on.
All right. Well, I think the plan is to try to do another one of these I see that question. The echo equipment is going to be the same.
Yep.
And we still have that ancient Vivid 7 that I remember purchasing for the CTRC, the GCRC at the old hospital. And so according to Brooke, that one's, kind of dying, and I think only supporting a single study at this particular point. So at some point that one will come offline and we may expand with another Vivid 9 or something even newer. Echoes will have to still be sent to be read. Right, Janine? I mean,
Yeah.
I don't think Diane, there's no.
Yeah, that's cardiology, goes to cardiology.
Yeah. So our plan is to offer another one of these town halls in September sometime, right, Janine?
In September, yep.
Okay. All right. Well, if there are no other questions, then I guess we can end this one early.
Oh, EKGs and chest X-rays. EKGs.
Those we won't have X-ray capability in the outpatient CTRC, so those will still have to be done over at the hospital. EKG machines will be coming over. We'll be able to provide those just as we do now. Same with what's that thing called, Diane, that measures liver?
FibroScan.
The FibroScan. We'll have the FibroScan over in the outpatient room as well.
Yep. And yes, the nurses will still be charting in Epic. So there will still need to be orders in Epic.
Yeah, and in terms of registering patients with an MRN and everything else, all that's going to be the same, right?
Right.
No change there. And I don't think that this doesn't pose any real change with Encore operations either, does it, Janine?
No.
Okay. Shall we call it?
Yeah, I just want to tell people to look out for the CTRC updates since the beginning of COVID have been coming from a CCTSI email. They go to all users. You should all be getting them. We send out the updates. Definitely check the CTRC Move webpage if you're not sure of anything. And there are contact details on that Move page if you want to ask questions or get more information. We're honestly sharing everything we know as we find it out ourselves. But if you have a question, please feel free to shoot it our way, because we do pass those things along if we haven't thought of them before or whatever. So thanks for doing that.
All right. Okay. Thanks, everybody. We will see you in September.
Bye.